Good morning from Nepal. This is Dr. John Bennett broadcasting for Neurosurgical TV. Today we have another in our weekly patient support for traumatic brain injury with Shannon Hilbert from Wichita, Kansas. And Shannon has a guest with her. I'll let Shannon introduce her. And we're also joined by a guest. Let me introduce him before we turn it over to Shannon. Good day, Alexis. Could you please introduce yourself?
Hello, I'm Dr. Narvaez. I'm a physician in Nicaragua. I'm also a professor, an assistant professor of immunogenetics, microbiology, and parasitology. I'm also currently certified by the Educational Committee for Foreign Medical Graduates in the USA, and I'm applying for a neurological surgery residency. And I'm here sharing some nice time with you guys.
Very good. And this is Alexis's first show. You just had an online interview at Barrows, which is a very prestigious neurosurgical institute in Arizona. Okay, Shannon, good morning, and it's all
Okay,
yours. It's all yours.
great. Well, it's nighttime where I am and nighttime where Dorian is, but it's not daytime where you are. Well, um, my name is Shannon Marie Hilbert, and I had a traumatic brain injury like 33 years ago, and it was terrible, and I was in a coma for like 6 weeks, and I had to learn to walk again and talk again and just function all over. I was 15 years old. I thought I was in a foreign country when I woke up. I didn't think I was in Wichita, Kansas. Um, I couldn't speak. I couldn't talk. I couldn't walk. I was tied into the bed, so I couldn't. You know, move. So I couldn't get up and hurt myself. And when I go to the bathroom, someone would go with me. So there was someone with me all the time. So I was a little bit paranoid. Um, and when I was in a wheelchair, I had like a posy belt on me, and I'd be strapped in the chair, and I'd have a a tray in front of me so I couldn't get out. It was very confusing. And in physical therapy, they put me on the vestibule board, so I could gain my balance. And boy, that was a trip, something I didn't like. But I that was something else. I wouldn't wish it on anyone, but I am 100% better, and I is through prayer and God's God's help. I'm sure that um, is why I'm here, and the good doctors that took care of me. And I think it is just awesome that I'm given the privilege of talking to some of the doctors that are going to be operating on um, patients like myself in the future. So I am going to interview right now Dorian, and she lives in California, and Dorian is a chiropractor. And Dorian travels all over the United States, and she gives lectures, and she's just a crackpot. I tell you that. Uh, so I'm going to let her tell you her story, and take it away, Dorian.
Okay. My story.
You need to speak a little bit louder, okay?
Oh, my story started about 30 years ago also. Like
Dorian,
yeah.
Dorian. Okay, speak louder. Hold that up to your.
Okay, is this okay?
Yeah, lean in a little bit.
Is this okay?
Yeah.
Okay, my story also started about 30 years ago. I was all set on going to medical school, and I was in college preparing for that. Well, after I graduated, I realized I'm going to be in school for an awfully long time. If I want to see the world, I better do it now. So I joined the Peace Corps and went down to Belize, Central America in 1985. When I was in Belize, I was teaching high school chemistry. And I was walking to school on the one paved road in the country, and somehow a tortilla truck ran into me and threw me up in the air, and I was in a coma. They immediately medevaced me to Florida Neuropsychiatric Intensive Care Ward. I was there for 3 weeks. My parents came and visited me several times. I couldn't speak, couldn't walk, had no short-term memory. Well, I came out of the coma in that situation, but they decided to move me closer to my parents who lived near Boston at that time. So I ended up in a hospital in Boston, Massachusetts. Well, I started regaining my perception, and I woke up, what seemed to me, I woke up all at once in this hospital in cold country because it looked like snow outside the window. I didn't have my glasses on, so I couldn't be sure, but that's what it looked like. And I was tied into my bed. I couldn't figure out what I was doing, tied into my bed. I tried to call for the nurses. I couldn't talk. So basically, I gradually found out that I'd had a pretty severe accident, been in a coma, was in this hospital. And they kept telling me, Dorian, you can't walk. I'd say, of course I can. They said, no, you had an accident. You can't walk. So I said, okay. Having no short-term memory, I forget we had that conversation. I get up and try to walk. And I would fall flat on my head. So they tied me into bed to protect me. And I woke up sort of tied into this bed, couldn't do anything. It was like, uh-oh, I better make some changes. So I submitted to their classes of physical therapy, occupational therapy, speech therapy, psychological counseling, and I was coming along okay, but then I realized that this was a hospital that was permanent. Once you were there for life. They didn't expect anyone to get better because we all had pretty severe injuries. Well, I realized where I was and what was going on, and I decided I got to prove to them that I'm okay. So, after a year, I signed up for a course at Boston College. It was a graduate level course and something about brain function. Well, I couldn't walk it, or I was in my walker at the time, taking public transportation. But I got the walker up on the bus, went to Boston College, took the course, did reasonably well. So I told the people in the hospital, okay, you have to let me go. They said, but no one's ever left here before. We can't let you go. So I wrote to the President of the United States I wrote to the director of the Peace Corps, and I wrote to the principal of the high school I've been teaching in down in Belize. They all wrote back to the hospital, said, I was fine. Okay, let me go back. So they actually let me out of the hospital. I am the one person in the history of that hospital to get out. Thank goodness. Well, I realized how damaged I was when I got back down to Belize because I was determined to finish my Peace Corps stint. It was a year and a half later, but I wanted to finish it. So my next door neighbor looked at me and said, I go to see a chiropractor once every couple of weeks. You want to come with me? I was like, sure. I'm in a third world country. Why not? So I went with her on the bus to see the chiropractor. It was an 8-hour bus trip one way from one end of the country to the other. But I went every 2 weeks and it was so fantastic. I applied to chiropractic school and I went to chiropractic school after I left the Peace Corps. So that's how I became a chiropractor. And that's essentially my story.
Okay, go ahead, Shannon. Okay, go ahead, Shannon.
Okay. All right. Dorian, did you what was the most difficult thing that you experienced in your recovery?
Most difficult thing was probably my whole right side was paralyzed in the
Your
accident.
right side?
My whole right side, and I'm right-handed. So I've learned to do a lot of things with my left hand, but writing is still difficult. And I somehow expected to be the same person I always was. But I found out that wasn't really possible because after your brain gets kind of scrambled, you're not the same. Not at all.
Mm-hmm. Now, I got my accident when I was struck on the left side of my head, so that affected the right side of my body. So I was paralyzed on the right side of my body. So I had I'm right-handed too, so I had to learn how to write with my left hand for a while, but I regained, and all that with the right hand. But that, I mean, that's difficult. You have to learn what to do.
Yeah.
But now tell me about eh, do you ever treat any people who have uh, experienced a traumatic brain injury in your chiropractic professional work?
Yes. We look for people like that because
I
my
know
husband,
physical touch is so important.
it is, and the body likes it a lot. But my husband was also in an accident when he was 10 years old. He was in a car accident and knocked out some bone in the front of his skull. So that was in the 1950s. So he's been fighting that a long time, and I've been fighting mine a long time. So we know we can help people. You have to allow the person, you have to make them trust you. And you have to have them be willing to give up the crutches they hang on. Because a lot of people learn to live with their injuries and don't want to give that up. For example, when I was in clinic in chiropractic school, I had a patient who was a woman, she had epileptic seizures. She wanted me to help her, but she didn't want me to help her too much. because she had seizures ever since she was born. She was in her late 20s and she never lived without having seizures. So she didn't know how to live without having her parents supporting her and having seizures. So she didn't want me to get her too well because then she'd have to support herself. And she didn't know how to do that.
Yeah.
That's scary. I've adjusted some developmentally disabled or mentally retarded people and made some tremendous differences in the way they interact with the world and other people. And that's been very gratifying. When a little boy who'd never spoken before, he was 9 years old, he told us thank you after we adjusted him the first time.
Did you go to any support groups after your injury?
I was too busy in chiropractic school after
Yeah.
my injury, but I did try a support group after chiropractic school because I figured it's something I should look into. That was probably the most depressing circumstance of my life.
Well, I'm sorry to interrupt. So, would you say like the mental issues were more than the physical issues in recovery?
For me,
Yes, for you, Dorn.
I am. I'm fortunate that I'm an extremely optimistic person. So I saw all these handicaps and disabilities as temporary kind of things. I never looked at them as permanent issues. And that's what the difference was between me and the rest of the people in the support group I went to. Because they view their injuries the most disastrous thing in the world that could happen to them. I didn't view my injury like that. I viewed it as an opportunity. So it was a real problem with the other people in the group, and that's why I ended up leaving the group because they didn't want to get better. They wanted to stay at the time, date, and second of their injury and never move on from it. I wanted to move on from it, and that's why I'm different from that. That's why.
Okay. Okay. How about the physical restrictions as a chiropractor? What kind of disabilities did you have initially when you first started working as a chiropractor?
Well, when I first started working as a chiropractor, I had and still have very poor balance.
Okay.
So I can't let myself get too out of hand with no one around me because I've fallen flat on my face in public before. But when I'm standing at the chiropractic table with the patient on the table, that's not a problem. I can adjust them and go on. I have decent balance most of the time.
Okay.
Just decent.
Okay. Were you doing anything to help that? Were you getting therapy or taking
Oh yeah.
medications for the balance, or you just kind of accepted it and worked with it?
Well, I accept and work with it, but I go to the gym still now, 30 years later. I go 3 times a week and spend a good 10, 15 minutes working on my balance each time I'm there.
Oh, okay. Well, could you do me a favor? Could you move your camera? You was just saying part of your face.
Is
There you
that
go.
is that better?
So, no, when I was saying your breasts.
No, that's not good either.
No, that's not good. It's not that time of day.
Um, trying to
A little
figure
bit
out.
up. That's okay. That's okay. We'll fix it. No problem.
It's a little teeny tiny little camera.
Little bit up, a little bit up. That's a little bit. Yeah, now we can see a whole face. Okay. Sorry to interrupt. So you kind of worked as a chiropractor, and you live with the lack of balance. There was nothing you could do.
There was nothing I do. I told you I go to the gym and I specifically work on it.
Right.
Try to make it better. I do, arm and leg and body exercises every time I go, and
Okay.
do what I can.
Well, one of the things that Shannon brought up, Alexis, in prior shows, is that every traumatic brain injury is different, and Doran's case is different than Shannon's case. Correct, Shannon, right? We went over that
Yes,
before.
that is
Everyone's
correct.
different. The way that you're affected is completely different than Doran, and you kind of have to individualize the treatment. Uh, now, Shannon, maybe this is a question for you, since you may have addressed it before in prior shows. How much do you have to kind of push your recovery, or are you guided by your therapist or your neurosurgeon? How much of it is you having to find out what needs to be done, Shannon? Maybe that's a question for
Oh,
you.
oh, heck,
Shannon, we're
heck.
losing your head. We're not seeing your head.
Okay,
There we
all
go.
right, all right, all right.
Okay.
Yeah, the I have. Let me tell you that it is quite. It's you. You can't rely on anyone. You have to be. You have as much as doctors and you have to be accountable for yourself. You
Yeah,
know.
that's an important point, Shannon. That's a very important point.
Yeah.
Yes.
You have to take responsibility and say, hey, if I'm going to get better, I got to investigate the resources on the internet, talk to other
Oh yeah. Oh
patients,
yeah.
talk to other
Yeah.
patients,
Oh
and we
yeah. No, I mean, yeah, I've looked up things on the internet on on new new situations, um new different different things about different aspects about seizures and all that. I
Mhm.
fell down um last Thursday, 2 weeks ago Thursday, and I just dropped. I just had a sudden drop,
Mhm.
and I've had these for about 10 years, and I wasn't taking my seizure medication, and that's what I think what caused it. And so I've been taking my seizure medication now. So um, and I messed up my right shoulder. So I have physical therapy tomorrow.
Okay, okay. One question,
So
Doran, how much of your recovery you have to be kind of a self-starting person and address? Did you address the lack of balance, or did your neurosurgeon or doctor say, "Hey, you've got to work on your balance. Do this"?
I, nobody told me what to do. I mean, I kind of directed my own therapy because the I didn't find the medical doctors very useful, and I was always arguing with them about what I needed. So my care was pretty much always self-directed. And I know enough about basic health care to be able to direct my own care. And
Okay. Okay. Can you guys hear Doran? Okay. Maybe it's me here in the office here having noise.
no, I think Dorian.
Y-
She's
No,
Yeah. If
I
you
probably
wasn't able.
get, yeah, you can't hear. If you can move to, could you repeat what you just said, Doran, and move closer to your microphone source?
I have my microphone. Is this better?
Yeah, that's better. That's
Tell
better.
me
Could you repeat what you just said, please?
I don't know what I just said. I don't remember, but I said something about my care was always self-directed because I know enough about healthcare to know what I needed. And my husband is also, I met him in chiropractic school. He also has a pretty good idea about directing my care. So I was always telling my medical doctor and my neurologist what I needed from them.
Hmm.
And they learned to trust me after some time. So they let me kind of direct my own care. So
Okay.
I found out what I needed to do from chiropractic school, from books, from the internet, and told them exactly what I needed. I had major epileptic seizures for about 20 years as well, and thank goodness they're done and gone. So that's a good thing. But no one really that hasn't had a head injury knows what to do because, like you said, and like Shannon said, everyone's different,
Right.
different in every case. The honestly, I'm on federal work comp, and they won't even give credit to people who've had a head injury because it's different in every case, and it can produce anything. So they will cover my seizure medication, but they will not cover anything. They will not give me any kind of disability payments or anything for my head injury because they will not cover that.
Right. Well, one thing I really want to address this to Alexis, as a physician on the internet,
Mhm.
you got to be very careful. You can't really tell patients to diagnose and treat their own
No.
injuries. You've always got to say, and to cover yourself legally, Alexis, uh, even on the internet, I'm probably in Nicaragua too. You should tell the patient to work with your doctor, listen to your doctor. However, there are some times when you can't get to a doctor and you're on your own. So
Yeah.
we're just saying to please work with your doctor, listen to your doctor, don't diagnose and treat. However, if there are times when you can't get to a doctor, or the doctor gives you directions and you don't know where to go from there, use the internet. Try to find resources on patient support groups and try to find out how other patients have handled similar problems. So, Alexis, do you have anything to say about that?
Yeah, I mean, I'm listening to Shannon and Dorian to try to get the idea of where they are going, and definitely every traumatic brain injury is totally different. It depends on several factors. For example, depends on the previous state of the brain previous to the trauma. Of course, every brain have a different level of plasticity. Plasticity is a term that we use to try to explain the neuronal response to trauma. And as well, it will also depend on where was the area of the trauma. So in the case of Shannon, it could be some more injury to the frontal area that is in charge of cognition. And in the case of Shannon, probably the dominant parietal lobe, which has to do with motor and sensation. So everybody is different, and it makes it very hard to address. So basically, the rehabilitation medicine guys are the best on this in terms of what can we do for the patient. Usually, for a neurosurgery, there's not much to do, but definitely believe that patient-physician relationship has to be established, and try to see your doctor as regularly as possible so that we can do the same that we're doing right now, which is support groups and try to find the best way to address all individual patients.
Do you get on the
So
internet?
that's yeah.
on
Well,
the
of course, internet it's a great resource for studying
the
any sort of disease, but definitely my recommendation is usually every patient has a regular doctor, which is the one where you feel more confident with, you have more trust, you have developed a better patient relationship, and you should ask your doctor for the best resources for
hmm
you to read. Because on internet there's a whole lot of information, and sometimes this one web page goes against the information that's in another page. So it's very hard for a patient to get the highest quality of information. I really believe patients spend more time studying a disease because they are going through that. They are actually the ones who know what it feel like
yeah,
or any
the
condition.
Brain Injury
But
Association
yep.
of America, BIA USA dot
Hmm.
uh, org, I believe is an excellent source to go
No
to.
question.
Yeah. Yeah. Well, basically, this format is a great way, Alexis, for us as physicians to hear the patient side
hmm
of view, the issues that they're facing. Oh, and you didn't see, Alexis, the other shows that Shannon had, where she went through the resources that are available for patients to become educated about their injuries and to become educated about the support groups that are accessible for them. So for us as
Now,
physicians, Alexis, it's good to hear the patient's side of view and from someone like Shannon that's been in the field for a while, who's
John,
investigated the different areas. It's good to hear from her. Yes, Shannon.
John, Dorian and I are both radio hosts on Brain Injury Radio,
Hmm.
so that's how we know each other.
Oh, okay.
So, yeah, Dorian has a radio show too.
Oh, okay. So how is your show structured? How do you guys structure your show?
Well, I interview survivors.
Okay. So every
My
week.
show is called Be Positive with Shannon Marie,
Oh, okay.
and
So, so every week you interview a different patient about their
no,
experiences.
and well, I'm on once a month, sometimes twice a month.
Okay. Okay, and it's strictly interviews, or do you have shows
Yes, I
like we
have.
had
Yeah,
where you give lectures or
no,
lectures
it's
on information available.
interviews. Yeah, and it goes all over the world.
Okay. How long have
It
you been doing
goes
that?
for 3 years.
Okay. Very good.
Yeah.
Very
Okay,
good.
Dorian, when is your show on?
Okay, my show, I also do it once a month, first Thursday night of the month. It's called We Deserve Better. I interview sometimes survivors, sometimes doctors who do a unique kind of therapy, or sometimes I just talk myself. For example, I was counting on someone who had an emergency at the last minute, so I had to go myself. So I just talked about some things I talked about. I used to do a radio show about chiropractic. So I did it about sleep because most pain people have problems with
Hmm.
sleeping. And so I talked about different cycles of sleep, how you get into them, how you can help yourself, and things like that. So my show kind of covers anything that I find interesting.
Oh, okay. Well, this is probably for Alexis's benefit more than anybody, because I've heard it from Shannon, and I heard a little bit from you about the main issues that are, generally speaking, a brain injury patient faces in their recovery. I think let's go with you first, Shannon. The main issues that you faced
The main issues that I faced
as a
were
brain injury patient recovering.
not to give up, not to give up, um, to to okay, the main
Well,
issues I faced. Um, yeah, not to give up, and I faced a lot of people saying, "Oh, you can't do that, you can't do that," but just say, "Oh, yes, I can," and just stride, just do it. Just
So
be
you were
determined.
your mood was affected. That was an issue with you. Your mood,
Oh
to
yeah,
be
yeah.
the depression, and feeling
Oh
like
yeah,
you feeling like you had something overwhelming going on.
Oh yes, sir. Yeah.
And that was one of the issues. So did you have many physical obstacles in recovery, Shannon?
Mm, well, no. When I learned to walk, and um I
Well, that's
learned
a
pretty
pretty big issue.
quickly.
Learning to walk is pretty big.
Huh? Well, uh from um okay, like January of '85 through uh, through May of '85. Well, January through '85 through March 20th of '85, I was in physical therapy. Well, I was in rehab, and then I was discharged on the 20th of March of '85, and then I had physical therapy, occupational therapy, and speech therapy during the summertime. Um,
Well,
and
well, well. Shannon. Let me just say that one of the things you said in the prior show kind of stuck with me because I started
uh
thinking. I
huh.
said, wait a minute. The brain is kind of like a computer, and a patient is using essentially a damaged computer, and to think, and they have to kind of formulate a plan, but with a damaged computer. And you mentioned to me in a prior show how it's good for you to write things down,
Oh yes, yeah. To
because
write.
sometimes you forget.
Oh
I don't know.
yes.
Like again, every patient's different, but in your particular case, you said you, it helped you a lot because you're working with a damaged computer, but it helped you to write things down. That
Oh,
way, you could
definitely. Yeah.
kind of you could attack certain
Oh
problems.
yeah. I mean,
Uh,
uh, write things down. I mean, in high school, and in college, and in my work. Yeah, and oh yeah.
did
And
you did
to
you
this day, I write a list down, of what I have to do, and I check it off. Did I take my pills? Did I,
right?
do this and do that? It's kind of
It's
silly, but
important.
it's common sense.
Okay, well, we're just joined by a late arrival,
Marco.
Marco from Bolivia. And Marco, I'd like you to Marco. Can you hear me? Okay.
Hi.
Yeah. Hi, Marco. Welcome. I'd like you to meet Doran to your right. She's
Hi
the
there.
patient,
Okay.
the traumatic brain injury patient survivor, and Shannon to your left. I think you've met Shannon before.
Yeah.
Hello, Marco.
Hi. Good
And
evening. Nice to meet you.
also a gentleman who's in the same position as you, Marco. He's applying for a residency in neurosurgery. Alexis.
Oh, amazing. Hi, Alexis. How are you?
I'm fine. You?
This is
Nice meeting you.
Marco. Marco is a medical student from Bolivia. He's applying for residency now in neurosurgery, and Alexis is applying too, Marco.
Oh, that's fine. That's good.
Okay,
Okay.
back to the issues here. Doran, did you find yourself in the same situation as Shannon, where you had to write a lot of things down, or you were kind of with it? You didn't need to do that.
Well, I had to do it, but I don't know if I did it as much as I should have because writing was so difficult for me.
Dorian, you
Yeah?
need a microphone.
Can you hear me okay?
No, you can't.
Not as good as we can. It just moved closer to the mic. Yeah.
I'm sitting right up on it.
Okay, that's a little better.
Okay. As far as writing things down, I should write down more than I do, but I still find writing very difficult. So I don't write things as much as I should. But I try to convince the people around me to remember things for me because I do
Okay.
have to write things down because that is a hallmark of brain injury. That your memory is not as good as you'd like it to be. That's also a function of getting older. My husband tells me, for me, it's probably more getting older than brain injury, but I don't want to admit that either.
Well, you know, we're kind of afforded actually the luxury of talking to two patient support people that have a experience with a lot of other patients beside their own case. Uh, so beside the cognitive remembering type of things that you see amongst other patients, what are the common issues that other you see in other patients, not yourself, but what are the common issues that other patients that you have interviewed over the years that are common? What would you say, Shannon, to start?
Well,
The
uh,
common issues that they face.
forgetfulness. Forgetfulness is a lot.
Forgetfulness, yeah,
Um,
you mentioned that about the memory.
yeah, forgetfulness and memory. Um, purpose.
Okay.
You know, not knowing what to do. You know, having no purpose. Um, that's
How about,
where that is where a support group comes in.
okay.
Um, to where you bond with other people, a peer support. That is so important.
Okay, very good. And how about you, Doran?
Anger. Anger is a very common symptom because people are different than they used to be and they don't know how to deal with it as well. They're not as
Okay.
emotionally equipped to deal with it as they were before their injury.
Okay, so that's a common trait you see in a lot of patients that you've talked to over the years.
Yes. And depression.
Okay. And
Very good one.
how do you suggest, besides, I guess you probably suggest them going to support groups to kind of vent their anger and,
Yes, you have to learn that it's not your fault and it's happened. You're not going to change it. You have to learn to live with it. And
right?
learning to live with it is the biggest problem.
Acceptance is the key.
Well, I imagine these support groups have great value because you can see that other people have the same issues, and you're not alone essentially,
Correct.
and that you don't feel like, wow, I'm really different. I'm having these issues, and nobody else is having them. Why am I alone? But if you see, you know, another patient having the same things,
Yeah.
I would think that's how support groups work.
And that is so important for doctors to know, um, that they need to, um, have that, um, available in the hospitals. Um, some type of support group available for the parents and for the caregiver and for the patient, um, so the fear doesn't is the fear is let go. Okay.
Mhm. Well, I don't know the system, the health system in the hospital so far. Well, normally, okay, maybe you guys can help me with this because you've talked to so many patients. Once the patient is treated, of course, the doctor, neurosurgeon is concerned about repairing the person physically, what happened to their brain.
The
Um,
psychosocial.
yeah, but as far as the other part of preparing the patient, when you go to follow up, say to your injuries, do you remember we getting direction from the neurosurgeon of where to go after that, or were you kind of left on your own?
No, that you're the psychosocial worker is brought in.
Okay, the social workers brought in.
Uh-huh, yeah.
Okay, was that your case also, Dorian?
Yes, yes. And both my parents are social workers, so I had a little bit more of that.
Oh, okay, so they kind of directed your mental recovery as far as physical the doctor took care of the physical, but the mental part of it was the social worker directed that part of it.
It is very important to get the helpers, the caregivers into the conversation
Hmm.
because they have to know what's going on as well to better understand what the victim, the survivor, is going through.
Hmm. And just like we said before, every patient is different. I guess every patient's recovery is different,
Yes,
and you both probably seen patients that recover pretty quickly and some that don't.
yes.
You know, that is um it's all about the family. It's all about how accepting the caregivers are,
Hmm.
you know,
Okay.
and the extent of the injuries.
The extent of the injury is a big one. Yes.
Yeah. Yeah, well, it's. I know as a physician, it's fascinating for me to hear about things like this because we usually, and Alexis and Marco will see this. We deal with patients in small snippets of time of 7 minutes, 10 minutes. You know what that's like, Doran, right?
Yeah. Yeah.
You know, John, I
Yeah.
remember you telling me about one patient you had uh, where uh, where you just uh, how you would would go in and see them and then just that would be it, and
Yeah.
then you release them and then they'd be on their way.
Yeah, well, that's why, and you guys know this, Alexis and Marco know this. When we see patients in the hospital, I mean, you're limited to 5, 10 minutes, sometimes more when you're a student, you spend a lot of time, but later on as a resident, you'll spend 5 or 10 minutes um, with the patient, and then kind of when you discharge them, you'll follow up with social workers, and you hope that they help out the patient too. But as far as this platform, we're able to, talk to you guys a little more extensively uh, in a relaxed manner to see what's going on. So it's certainly beneficial for me, and I think Alexis will benefit and Marco will benefit. Any comments, Alexis, on that?
Yeah, definitely. I strongly suggest to try to get as much support from the family. I strongly believe the family after TBI is more important even than us, the physician. We really
Okay.
rely on your family, really rely on your own will of going through all this and just to improve yourself. Depression itself, it's one of the most dangerous diseases. So my advice always try to avoid it. Always just struggle against it. And the best way is get the support from the family and always believe in yourself. There are thousands of people going through similar situations than you. There's always somebody who is at a worse position and somebody who is in a better position.
Well,
That's how life is.
there is the International Brain Injury Association, and Nicaragua is
Uh-huh.
available. And Nicaragua is a member of that association.
I'm not quite sure. We're not
No,
members
they
of
are. They are,
some.
and they
For
have
real?
information.
I have to check on that.
Yes,
Yeah,
John.
yeah. Go give Alexis the
Could you
website.
share the link?
Yeah, get the
It
link.
is
Can you get? We'll get the link right now.
Okay, you're gonna get the link right
Well,
now,
tell,
John?
tell me what it is. I'll put it on the internet right now.
IABIA.
IABIA. Okay.
Uh huh.
Can you write it down in the chat, please? That's a lot better. Write it down in the chat box. What that web address is. You know the chat box, right, Shannon?
No, I don't.
Oh, okay. Well, write it in your Facebook.
Okay, hold on a minute.
Yeah, sure. How about you, Doran? Did you get a lot of support from your family after injury, or you were in the third world, or did you come back?
They shipped me right back to Florida when that happened, and I was moved back up near my parents. Yeah, if it hadn't been my family, I don't know what I would have done, because they helped me through in the hospital. When I kept telling the hospital, I'm going to go to graduate school. I'm going to continue on my way. And the hospital's like, no, you're not. You've been injured. And I said, yes, I am. And luckily, I had my parents to support me. And I was getting a lot of support from my parents and college friends at that point. And that really helped me. And I wanted to mention, too, that there are groups on the internet. I've been a member of several discussion groups about brain injury. And it's very handy because you come in when you want, you talk, you ask questions, you get them answered. I find it very helpful.
Okay. Well, hopefully there'll be other resources, and yeah, we'll get Alexis the website for the. We've had prior shows, and maybe you guys can watch them of internet resources for traumatic patient injuries. What do you use internet resources, Doran, as far as resource things to go to or things you recommend to patients? What are the common recommendations you have of internet resources?
Okay, well, the Brain Injury Association has a lot of what you need on it in different forms. And you can find out specific links from that big website. I don't have any links on hand.
Is that BIA.com?
Yeah.
Brain Injury Association?
The international is internationalbrain.org.
Brain.org. I'll type that up.
Yeah, internationalbrain.org.
Okay. We'll screen share that. One of the wonders of this beautiful platform is the screen sharing aspect of it. Okay, this is the website that both you guys use. You use this, Doran, also?
Yeah, I've been on that one. Yeah.
Okay, let's see if there's a Nicaragua. We could find the Nicaraguan one, right, Shannon?
Oh yeah.
Where would we look under that? Where would we find Nicaragua? Calendar events, Board of Governors. Update my profile.
Okay, Reese. Okay, languages. What language do Nicaraguans speak?
Okay, well, rather
Spanish.
than wait, Spanish. They have a Spanish. They have the Spanish option here. Am I missing it?
Yeah,
Oh, okay, it's in Nepalese for me. I can't read it. Can you guys?
it's Spanish. Yeah, okay. Um,
Okay. Well, anyways, Alexis, here's the website. It's internationalbrain.org. I'm sure it can be found. But for both you guys, this is a pretty reliable resource.
Yeah,
uh-huh.
I mean, I was
Yeah.
looking for it in the internet and I wasn't able to find it.
Okay, we can find it later. But okay,
Okay.
I think we'll wrap it up for today. I think we've covered a lot of ground, and I appreciate Doran for joining us. Um,
And I want her to come back.
yeah, and you're welcome to come back. We'll work on the tech. I had some internet problems, and we're having some camera problems, but we'll get better at this. But basically, I wanted to show Alexis this aspect of this platform of having the patients be able to have a forum to air their issues.
Oh,
Uh,
yes.
because it's hard for some patients to get to a meeting, a physical meeting.
Yes.
But most people now, like Shannon, have smartphones, and the Shannon is joining us now with a smartphone. And everyone
Yeah.
has a smartphone. Everyone has a smartphone in their pocket. So we'll wrap this up formally and stick around to chat. Thank you.